On the occasion of the National Youth Day this year, Prime Minister Narendra Modi met 10 people, youngsters who have been working and excelling in their fields. Also from Madhya Pradesh, from the Satna district, Prime Minister met Swapna Verma. She is a doctor and she's been working from last many years for the betterment of the society and in the health services. We have Swapna Verma with us. Let's get into a conversation with her. Ma'am, welcome to India today. You met Prime Minister this year. What was the reason that Prime Minister's office selected you, and what have you been working on that Prime Minister called you, and what was the conversation with him? How was the moment when you met the Prime Minister?
As First of all, thank you very much for this interview. And Prime Minister's office is like a youth and sports ministry has invited the applicants from all over India. And among those applicants, there were few, especially the 10 presentations were selected to show to our Honorable Prime Minister one-to-one and explain the entire project, what are they working on and what will be the impact, what the impact they have created to the society. So I was one among them. And it was a very proud moment, and it is a very proud moment because the citizen of being citizen of our country in India, we just have seen the Prime Minister on television, and always we have heard him, and this was a moment where I could see him face to face and interact to him. So it is for me, a normal person like me, it is very proud moment that he has recognized, and the entire ministry, I'm very thankful. The Mansukh Mandya ministries, I'm very thankful that they have taken such a great efforts from pan India selecting the youths, and there were many youths after this after the 10 youth also the presentation, there were many youth who has addressed many things, whatever the initiatives they have taken. But yes, we got this opportunity to talk to our Honorable Prime Minister, and it is like such a innovations. I could feel the sensation when our Honorable Prime Minister had come to my table and know about my project like Bimari Mukta Bharat. What is the project we are heading into?
So, what is this project, Disease Free India? What are you working on? Because you are working in a field which require much and much resources day by day. So, what is your project about, and what did Prime Minister say after he heard about your project?
See, this project is completely inspired by our Honorable Prime Minister. After COVID, I have dedicated my entire education and entire my knowledge, what I uphold within me. I have decided that I will work for my nation, and I will work for my society to upgrade and uplift my society. This dream of our Prime Minister, Bimari-Mukt Bharat, when he said this on before 5 years, I heard him on a television that he dreamed for a Bimari-Mukt Bharat, Swasth, Samriddh and Sashakt Bharat. That day itself, I started dreaming and how the India could be. Because I come from the family where my mother itself is suffering from last 12 years, and she is a bedridden patient. She is a Parkinson's patient, and I couldn't do anything being a doctor. Also, I couldn't do anything. I couldn't help her. So that day I realized that really a disease in a family really kills the emotions and the mental condition, the financial condition of a family. That day I decided, and yes, I will definitely, whatever education I have received till today, now it will be for my nation, and I will work, whatever the projects I will work, it will make sure that these projects are really uplifting my country, uplifting my Bharat Mata.
What is the process of your project? How are you working, and how many people have you connected till now?
Yeah, so this is a project where we call about Bimari Mukta Bharat. Bimari is just not about disease. Bimari is like wherever I see, wherever it's in my opinion, I see my country, my nation is being captured, or my nation is being, it's being suffering like from the disease that is from true, that family problems, the disputes and the mental illness. So all these things I have, we have visualized it and now presented this in one project called Bimari-Mukt Bharat, and this is Satna Sankalp. We have grounded this project over the last 3 years from Satna district, and near about 6 lakhs pupils we have approached in Satna, entire Satna districts, and among them we have made the what we do in this project, we knock door to door and we start screening them their health. In during the health screening we will do the CBC, blood sugar, urine routine and thyroid, because this is a test which will tell what is the pathological and the physiological changes in your body, what your body is going through. So within these changes we can make a graph and make a chart that what is this person is suffering from, what is this individual is suffering from. After that we counsel the family and we make entire things digitally, because this is a first innovation in our country, which is a health camp at your doorstep, but entire thing is into a digital platform. So we capture the data entirely digitally, and we make sure that we have made the entry of each and every things what we have, the procedure of the camps during the camps. While doing this, we also make the family tree chart. Why does it require? Now the question was yours from your side. Family tree chart. While making the family tree chart, we try to analyze what is the genetic condition this family can suffer in future, like over the period of 10 years. So when we talk about Bimari-Mukt Bharat, it's not instantly anyone can do or a magic. But yes, over a period of 10 years, what India we are dreaming for, how our Bharat will be. So while making that tree chart, we make sure that we have fed that data digitally, and then we time to time we counsel the family, that family, that parivar, we counsel that yes, your family parental side you have this issue, so you make sure that you have in your lifestyle, you should have these changes, the lifestyle changes. While doing all such things, we will make sure that we have given them the instant treatment. Then we have also attached them to the district hospital, and in middle of this we make sure that they have done the lifestyle changes, the food changes, the wellness changes, the yoga changes, the breathing exercises, and the family disputes also we address.
What did the Prime Minister say about your initiative after you gave him your presentation?
Yeah, it is was my dream. I cannot explain in words the project which I started from our honorable Prime Minister's listening, Bimari Mukta Bharat, and today at 2025 January, 12th January, it is like a most memorable day of my life.
Did he appreciate you?
Yes, he appreciated a lot, and he said that that's what I was telling you. Like once you start any initiative as a youth, and you put it in the ground, and that initiative has come in front of our Prime Minister, it's a very big thing. He has appreciated the project. He has spoken about how many employees are working there, and how, and in fact his interaction was so healthy. I could find that our Prime Minister is so much into the project that he could ask how many employees and from where the employees are working. So he's also concerned at that time whether the employees are from Satna and whether I have given the employment to the people who are local.
Did he say to like help you in the coming days for your project? Will government help you?
Yes, definitely. He has promised that the youths are important, and minds like us who are really has grounded a few things which is bringing an innovation to our country is very much will be helpful for the from the government side also. And he has asked me like whatever the support and I require from the government side and from the society side, and whatever the supports we require, so we can ask the government. And definitely, and in fact till today the government has been very helpful to us while working during the local communities. Yes.
Thank you so much for talking to India Today. So this was Swapna Verma. She's been working in the Satna district from last many years, progressing in the field of healthcare. And she says that central government will also be helping to her project, and they'll be progressing day by day more. With camera person Amrish from Bhopal, Amritanshi Joshi for India Today.